This is Suprava. Welcome back to another session of Modern Concept of Childcare. In today's session, we will be learning about a child health nursing procedure. So basically, this is a procedure through which we gain access to the bone marrow particles. Can you guess the topic? Yes. So today's topic is bone marrow aspiration. So first, let us understand the meaning of bone marrow aspiration. So bone marrow aspiration is an invasive procedure in which a bone marrow needle is inserted into the bone marrow to obtain bone marrow particles. So basically, bone marrow aspiration procedure is a procedure in which we insert a bone marrow needle. So basically, we use a needle which is known as bone marrow needle, and we insert this to the bone marrow of the patient, and we collect bone marrow particles. So this is what we mean by bone marrow aspiration. Now, what are the cells which we study through this procedure? So, cells which are studied through these procedures are erythrocytes, leukocytes, and thrombocytes. So, these are the three cells which are studied by this procedure. Now, the next question comes that what is the purpose of this procedure? Why do we perform bone marrow aspiration? So the first thing is to diagnose any disease, or to determine the stage of the disease. So such as leukemia, multiple myeloma, lymphoma, anemia, thrombocytopenia, or pancytopenia. So the first thing is to diagnose any disease or to determine the stage of the disease. So for example, if there is leukemia or multiple myeloma, so to determine the stage of the disease, at what stage the leukemia is or the multiple myeloma is, or at the first step to diagnose the disease, we use this or we perform this procedure. Next, if there is thrombocytopenia, so if there is deficiency of platelet counts in the blood, to understand what is the cause behind that, and what is the level of the deficiency, actually to understand that, we perform bone marrow aspiration. And also pancytopenia, when there is deficiency of all the three components of blood, that is and next is pancytopenia. So when there is deficiency of all the three components of blood, that is the red blood cells, white blood cells, and the platelets. So to understand that also, or to diagnose and to determine what is the cause behind that, we perform bone marrow aspiration. The next purpose is to monitor the development of hemolytic diseases. So, if there is any kind of hemolytic disease present in the patient, to understand the development of the particular hemolytic disease, we perform bone marrow aspiration. And also, sometimes when the treatment is given, and after that, when we do bone marrow aspiration, we actually get to know that how the treatment is responding, or whether the treatment is responding or not, and what is the result. So to evaluate that also, we can say to evaluate the treatment what is being given to the patient, for that also bone marrow aspiration is performed. And the next purpose is to obtain more information on hematopoiesis. So these are some of the purposes for which we actually perform bone marrow aspiration. Now we understood the purpose behind this procedure, and what is the purpose, why do we want to do it. Now next, let us learn what are the indications. So what are the conditions in which we basically rely on this procedure. So the first indication that we can see here is that to investigate children with abnormal peripheral blood findings. For example, atypical cells. So when there is any kind of abnormal cells, any abnormalities present in the cells, for that also this procedure can be performed to understand what is the reason behind that, what is the cause, anemia or thrombocytopenia. So these are some of the diseases when we get any abnormal peripheral blood findings, we perform bone marrow aspiration. The next indication is to diagnose malignant hematological disorders. So, when there is any kind of malignancy or malignant hematological disorders, so to diagnose that also, bone marrow aspiration is performed. Sometimes there is metastatic spread of tumors, and also there are some inherited bone marrow failure syndromes. So for that also bone marrow aspiration can be performed. So if in case there is any kind of inherited bone marrow aspiration syndrome is there, through bone marrow aspiration procedure, we can find out that if there is anything like that. And sometimes when there is metastatic spread of tumors, for to find out that also we can perform bone marrow aspiration. The third indication that we can see here is that for investigation of hypersplenism, or if there is lymphadenopathy, or if any kind of abdominal masses are present. So for that also bone marrow aspiration are performed. And the next indication is for follow-up after chemotherapy or stem cell transplant. So as we were discussing in the purpose that sometimes the bone marrow aspiration procedure is performed to understand the result or the progress of the treatment, how whether the treatment is working or not. So here, after the chemotherapy or after a stem cell transplant, bone marrow aspiration is usually done to see whether the treatment is working or not. So these are some of the indications. So let us move to the next part where we will learn about the contraindications of this procedure. So there are certain conditions where we should not perform bone marrow aspiration. So what are those conditions? Let us learn. So the first one is any kind of hemorrhagic disorders, such as if there is congenital coagulation factor deficiency, for example in hemophilia. So that is a congenital condition where there is absence of coagulation factor. So in that case, you know that what happens in hemophilia, right? So there is a high risk of hemorrhage. So if any kind of such kind of hemorrhagic disorders are present in the child, then we are not going to go for bone marrow aspiration for that child. So next contraindication is if there is skin infection, if there is any kind of skin infection at the site, or the child has recently undergone radiation therapy at the sampling site. So in that case, bone marrow aspiration will be contraindicated. The next thing is that any kind of bone disorders such as osteomyelitis or osteogenesis imperfecta. So in these kind of conditions also, child won't be advised to go for the bone marrow aspiration. So now we understood that what is the meaning of bone marrow aspiration and in which all cases we should do bone marrow aspiration and which all conditions are contraindicated to this procedure. So next, let us learn that what are the common sites from where we can collect this bone marrow. So the first and most preferable site or location we can say is that iliac crest. So we can use the posterior or superior part of the iliac crest, and then from sternum also we can collect bone marrow, and last one is tibia crest. So next let us learn the common locations from where we so the first location is iliac crest. This is the most preferable location that we use for bone marrow aspiration. So basically we use posterior superior iliac crest, and then we can collect the bone marrow from sternum and also from the tibial crest. So the preferred site for obtaining bone marrow in children is the posterior superior iliac crest, because it contains the most cellular bone marrow and there is no vital organs adjacent to this part. So that's the reason this is the most preferable site for collecting bone marrow in children. And children who are younger than 1 year, basically who are younger than 18 months of age, the tibia crest is used for those children. But whenever this site is used, it is very important that the technician is very competent, because there is a high risk of fracturing the bone. So that's the reason this site is mostly it is not used. But if the child is below 1 year of age, in that case, this site is preferable. So the most preferable site is posterior superior iliac crest. So these are the common locations from which we collect the bone marrow in children. So these are the common locations from where we collect the bone marrow. Now next, let us see what are the different types of bone marrow needles are present. So the first one is Clima sternal needle. So this is one of the needles that is used for bone marrow aspiration. The next one is Sala bone marrow aspiration needle. So this Sala bone marrow aspiration needle is also used for bone marrow aspiration procedure. And then next we have Waterfield iliac crest bone marrow aspiration needle. And fourth one is modern Jamshidi needle. So these are some of the types of needles which are used for bone marrow aspiration procedure. Now the next thing is that what are the complications of this procedure? As we are telling, this is an invasive procedure, and we are going to insert the needle to the bone marrow, right? So there are some risks involved, some complications involved. So next we are going to see what are the possible complications that might occur in during or after the this procedure. So the first complication that we can say is infection. Now, as we have already learned that this is an invasive procedure, and we are we are inserting the needle to the bone marrow. So if the needles or the equipments that we are using, that is not correctly cleaned, or the aseptic technique is not followed, in that case it might carry infection, and it might transfer the infection to the bone marrow, right? Yes. So in that way, definitely there is a high chance that the infection, there might be infection. And also, as we are invading the tissues and the bone, and we are gaining access to the bone marrow, in that case, there is a high chance that if the environment is not hygienic, in that case also, if infection is present in the environment also, that might enter to the bone marrow, and the patient or the child might have infection in the bone marrow. So this is a major complication of bone marrow aspiration, that is infection. And the next complication is bleeding. So while discussing about the contraindications, we were already discussing that if there is any kind of hemorrhagic disorders, right? For example, hemophilia. In that case, this procedure is contraindicated because there is a chance of bleeding. So many times, if the patient's coagulation time is very high, if it takes for the patient, it takes time to clot the blood. So in that case also there might be high chance of bleeding. So this is one more complication of bone marrow aspiration. Now, everybody is not going to have these complications. So, what are the risk factors that we should be aware that if those risk factors are present, then the patient might experience those complications. So let us learn what are the risk factors for complications. So first thing is if there is any kind of bleeding disorders, or as I told you that if the bleeding time is high, in that case, if the patient takes a lot more time to patient's body takes a lot more time to clot the blood, in that case also there is a chance for the complications that the patient might have severe bleeding. And if there is any infection of the skin, from where the bone marrow is taken, or from where the bone marrow needle is inserted. So if there is any kind of infection, that infection might might transfer to the bone marrow, and in that case also the patient might get infection in the bone marrow. And the next risk factor is infection in the bloodstream. So, if there is any kind of infection which is present in the bloodstream, any blood infection is there, and when we insert the bone marrow needle, from that, the infection might transfer to the bone marrow. So, that is a risk factor for the definitely, it's a risk factor for the complication. So, we have to be aware of these things, and we have to make sure that these risk factors are not present in the patient. And even if it is present, then adequate management should be taken. Now, the next part will contain what are the nurse's responsibility before the procedure, during the procedure, and after the procedure. So now we will learn that as a nurse, as a pediatric nurse, what you should do when there is a bone marrow procedure which is going to happen to your patient. Well, so the first thing is assessment, which is very important. You know that in nurse's role, the first thing that comes is assessment, right? So you have to do your assessment very perfectly. So in assessment, the first thing that we do is we check the primary diagnosis of the patient, and also the treatment protocol, to understand what is the need for this particular study, or what is the need for this particular procedure. So the first thing that we are going to do is we are going to check the primary diagnosis of the child, and then we are going to see what is the treatment protocol that is being followed for the child. And we have to understand that what is the need for this particular study, whether there is any special requirements for the child. So this is what we are going to do in the first step. And then you have to check the platelet count of the patient. And once you check the platelet count of the child, you have to check whether the patient has a history of any kind of bleeding disorders, or whether the child is currently on any anticoagulant. So once you gather this information, you have to assess the skin from where this bone marrow will be taken, or the bone marrow needle will be inserted. So you have to check whether if there is any kind of infection or redness, or any kind of inflammation which is present, or any kind of rashes what you can see. So if these things are present, that might indicate that there is an infection. So to check that, you have to assess the skin from where the bone marrow will be taken. And then you have to ensure that all the necessary personnel are present over there. For example, the lab technicians, or if you need an assistant nurse, and whoever is required for this particular procedure, you have to make sure that all the personnel are present over there. So once you do this, you have to confirm the patient's identity. So you're going to greet the patient and check the patient's ID and confirm that this is the right patient. So after that, there's a very important step which we follow for all the procedures. Can you guess? Yes. So you have to explain the procedures to the parents. So you are going to explain the need for this study, why this particular study is being performed for their child, and how the child will be taken care of during the procedure. After the procedures, what are the care and treatment will be given to the child, and if there is any kind of complications involved in this procedure, that also you need to inform to the parents. So everything should be clear, explained very clearly to the parents. And then you're going to arrange your equipments, that is the articles which you need for the procedure. So we need a big tray with a disposable dressing set, cotton balls and gauze, sterile gloves should be there. There should be face mask, and then you should have your bone marrow aspiration needle, and also the cleansing solution. And then you should have the anesthetic agent, that is, for example, lignocaine or lidocaine, however it is prescribed. Based on that, you have to make sure that the anesthetic agent is also present. And then you should have the medication tray with the pre-medications that is being ordered. So if there is any pre-medication which is prescribed that should be given to the child before the procedure, that also should be there. And then you are going to have the laboratory form according to the type of test that you're going to do. So the next thing, after arranging all the articles, the equipments, you're going to do hand washing. So you're going to follow all the steps of hand washing, and you have to do hand washing, and then you have to come for the procedure. So before the procedure, you need to provide privacy to the patient, and you have to make sure that you position the client in a proper manner. So as we have already discussed that there are certain common locations from where basically the bone marrow is taken. So usually the doctor would choose the site, and based on that you can position your client on the based on the doctor's chosen site for the procedure. And then you have to expose the insertion site, so where basically the bone marrow needle would be inserted, that portion should be exposed. So once you expose this insertion site, the next thing that you have to make sure that the child is properly immobilized, or completely or appropriately immobilized, and that the airway is not compromised by the positioning. So when you are positioning your client, you have to make sure that the airway of the patient is not compromised, and also as this might cause pain to the child, because this is an invasive procedure, right? And that's the reason here you have to make sure that the client is complete or appropriately immobilized, or else that might cause problems during the procedure. So if there is any kind of topical ointments that was given on the skin, usually there will be before the procedure, before 30 to 60 minutes, they might give some topical ointment. So if that was given, then you have to remove any kind of topical ointments that is present on the skin. And then you are going to palpate the iliac crest and locate the site of aspiration. So from where the bone marrow would be taken. The next thing is open the tray with sterile technique. So we have already learned that what are the complications that might happen during this procedure, and we have understood that there's a high chance of infection, right? So here, that's the reason we have to follow all the aseptic technique. While opening the tray also, we have to use the sterile technique. So whatever steps you are going to follow, whatever practice you are going to follow, that should be by sterile technique. So after that, we are going to cleanse the area with antiseptic solutions. So here we are going to use a circular motion. So when you are cleansing the skin, we are going to use a circular motion. And you have to remember that you should go from inner area to outer area. So that is how we will cleanse the skin. And we will repeat this cleansing twice or thrice. So once we are done with cleansing the location from where the bone marrow will be taken, after that we are going to drape the patient. So we are going to place sterile drapes over the operative site. So these are the responsibilities that you should do as a pediatric nurse during a bone marrow procedure, a bone marrow aspiration procedure. Now, next, let us learn what you should do during the procedure. So when the procedure is happening, when the doctor is doing bone marrow aspiration, what you should do as a pediatric nurse. So the first thing that you should do is monitor the vital signs to detect any kind of complication. So you have to continuously monitor the vital signs, and check if there is any kind of deviation or any kind of abnormalities present in the vital signs. That would tell you if there is any kind of complications that might happen, or if there is any a deviation or any abnormalities are happening during the procedure. And then one more thing that you should do here, that you have to help the client to remain in the right position, as we know that this is an invasive procedure and this might cause pain, right? So and we have a pediatric patient here, so it is very important to immobilize the patient appropriately. But then also, if the patient is having pain, there is a chance that the patient might move around. So to prevent that, you have to make sure, you have to help the patient to remain in the right position. And then you have to assist the doctor in the procedure. So whatever equipments the doctor needs, whatever articles the doctor needs, you have to provide that, and you have to help the doctor, you have to assess the doctor during the procedure. So this is what you should do as a pediatric nurse during the procedure. The next thing is, after the procedure, what you should do. What is the nurse's role after the bone marrow aspiration procedure? So once the procedure is done, you would transfer the patient to a recovery room. And what you should do in a recovery room? So when the patient is in the recovery room, you should monitor the patient and the procedure site very carefully. So you're going to assess the vital signs, you're going to monitor the vital signs continuously, and if there is any kind of deviation in the vital signs, and also with that, you have to monitor the procedure site. So if there is any kind of signs or any signs of infection, for that you need to monitor the procedure site carefully. And the next thing is that if you have noticed that there was severe bleeding during the procedure, and there was prolonged bleeding at the site during the procedure, or after the procedure it is still going on, in that case you have to check the platelet count, because there might be need of platelet transfusion. So to check that, you have to you have to continuously monitor, you have to continuously check the platelet count of the patient in case if there is prolonged bleeding at the site. And while at discharge, you have to instruct the parents about what not to do and what to do, right? So here, what you are going to instruct the patient is that not to use any painkillers, that is for example, ibuprofen or acetyl salicylic acid. So many times what happens when the child says that there is pain, the parents might use these things at the procedure site. So you have to instruct the parents not to use any of these at the procedure site. What is the reason? Because these drugs can cause platelet dysfunction. So these things you need to explain to the parents, and you have to advise them strictly not to use ibuprofen or acetyl salicylic acid for the pain at the procedural site. Also, you have to instruct the parents to remove the dressing over the procedure site within 12 hours, because if it is left beyond that time, then it might cause skin infection, or there might be a chance that the child might get infection. So to avoid that, you have to instruct the parents to remove the dressing which is present over the procedure site within 12 hours. So this was all about the nurse's role during the before the procedure, during the procedure, and after the procedure. Now let us conclude today's topic. So today we learned about bone marrow aspiration, and by bone marrow aspiration we mean to say that this is through this in this procedure we insert a bone marrow needle to the bone marrow, and we obtain the bone marrow particles. And we learned that erythrocytes, leukocytes, and thrombocytes, these are the cells which are studied by this procedure. So basically, we do this procedure to diagnose any disease, or to determine the stage of the disease. If there is any kind of hematological disorder present in the child, if there is atypical cells, pancytopenia, or many times if we want to monitor the progress of any hemolytic disease, or we want to see the progress of treatment that is being given to the child, for that also we do this procedure. And then we learned if there is any kind of hemorrhagic disorders, for example hemophilia, we bone marrow aspiration procedure is contraindicated in those cases. And there are certain possible complications such as infection, bleeding. So this was all about bone marrow aspiration. I hope you have gotten better insight about the topic. Thank you.